I want to touch on ivermectin a little bit. You
Sure.
know, you definitely know a little bit about ivermectin. You said on stage earlier that this may be a direct quote, I'm not sure, but that, any amount of it is actually still safe, which that struck me as a very strong statement.
So when I said that, I mean, meaning the point I was making is with hydroxychloroquine, in the war on hydroxychloroquine, one of their tactics was they designed trials, which were heavily published, where they used sublethal doses. So they used toxic amounts of hydroxychloroquine. The patients treated with hydroxychloroquine in the hospital got sicker, and they died more commonly. And that was used to fuel two narratives, that it was a dangerous drug and that it didn't work. If you were to design a trial using ivermectin, if they used twice the normal dose, 3 times, 4 times, 5 times, 6 times, there would be no toxicity. Now, to say that there's no dose that could make anyone sick, well, let's talk about that. So in a comprehensive review by one of the world's famous toxicologists, a man named Jacques Descotes, he's a French scientist. In his review, certainly if you take 100 to 1,000 times the normal dose, some have gotten ill, but they're self-limited. No one's died. They've gone to the hospital, usually with confusion or what we call encephalopathy. But with supportive care, they have improved. In fact, in his review, he says there's not one confirmed or proven death associated with ivermectin, even in massive overdose. So not to say I would design a trial with 100-fold the normal dose, but what I'm saying is even if you doubled, tripled, quadrupled it, it would actually work better. And so what did they do in their trials, Jan? They underdosed. Because they knew they couldn't, I'm just speaking about the research fraud that I've had to witness in trying to disprove this drug. And so they couldn't use that tactic with ivermectin, whereas they used that tactic with hydroxychloroquine. Ivermectin, they did the opposite. They shortened the duration as much as possible. They started it as late as possible, and they gave the lowest doses that they could get away with. Because they wanted to try to show the inefficacy of ivermectin.
We live in an era of censorship and disinformation, and it can be really hard to know what's true and what's false in this information climate. To get honest information and insights you can trust, join us on Epoch TV. You can sign up for your 14-day free trial at ept.ms/freetrialjan. That's ept.ms/freetrialjan. It's almost like, medicine turned around.
Jan, you sound like me a year ago. Like when I came out of ivermectin, I thought like this paper and our review was going to help the world, and actually we did help a lot of people, but I didn't understand what was happening after that. The attacks, the dismissal, these narratives that it's a horse dewormer, that the studies are all small and low quality, they're not peer-reviewed, they're not randomized. Like I can recite all of the narratives that I saw develop around ivermectin. And what changed my life was the day that I received an email. I received an email from one of the world's premier experts in vitamin D. And it was a short email. I didn't know who he was. And he wrote the following. He said, Dr. Kory, what they are doing to ivermectin reminds me of what they've been doing to vitamin D for decades. And he sent a link to an article called The Disinformation Playbook. And it's written by the Union for Concerned Scientists. It's a short article, and it lists the tactics that corporate interests employ when science emerges that's inconvenient to their interests. The science around the efficacy of ivermectin has never been more inconvenient to the pharmaceutical and vaccination industry in history. There's never been a molecule or a compound that threatens more of that industry. And so when you think of it in that terms, what happened to ivermectin made sense. And there's numerous examples of these disinformation campaigns. And by the way, you want to know who invented disinformation campaigns? The tobacco industry. They perfected the tactics for 50 years. And ever since, numerous industries have borrowed that when science emerges. So for instance, the NFL. When chronic traumatic encephalopathy, when those researchers started to highlight the fact that these retired football players were developing severe mental illnesses, rashes of suicides, and were becoming disabled because of tiny hemorrhages along the brain, what did the NFL do? they embarked on a disinformation campaign, and they used all the tactics. They had bogus studies saying that it didn't exist. They attacked the researchers who were trying to bring this forth to the public, and they did a number of things trying to suppress this evidence that was inconvenient to their goals. That's the NFL. Now think of a global marketplace for vaccines and therapeutics. And that is what my life became. I had a front row seat to endless pervasive disinformation around ivermectin, and I will tell you they largely succeeded. In most of the advanced health economies around the world, it's not recommended. Most of those agencies which are under the influence and control of the pharmaceutical industry specifically do not recommend. But get this, 25% of the planet lives in a country where ivermectin is broadly available, widely used, if not recommended by those governments. So it's not the whole world, but I would tell you the advanced health economies of the world, they've done a really good job by controlling media and the agencies to dissuade doctors from using. And they've done even more. Now, if you try to prescribe it, first of all, the hospitals removed it from their formularies. Jan, this drug was so toxic that they had to remove it from the formularies. It's one of the safest drugs known to man, and yet they removed it, just like they removed hydroxychloroquine. And so what I got to witness is not only the tactics that they deploy, but the power in which they hold, like how it rippled down. It rippled down to retail pharmacies, would not refill my prescriptions anymore. No, it's not FDA approved. By the way, as you mentioned, FDA doesn't have to approve it, but now I have pharmacists parroting the fact that it's not FDA approved. And I said, I know, it's a repurposed drug and I'm using it for COVID. And they say, I won't fill it. It's too dangerous. And that's the war that I've had to fight.
I'm just going to have to comment because I've said this before in interviews, but how many billions of people have taken ivermectin for river blindness, or I think that's the use that I'm familiar with. I mean, didn't someone win a Nobel Prize for it?
Well, yeah.
I mean, it's still. I can't believe we're still talking about this, and I'm still flummoxed.
Well, I'm glad you understand some of the perversions here. I mean, one of the safest medicines known to man, and the government and the agencies and the pharmacy boards and the medical boards have to punish anyone using it. The funny thing is, none of the studies show that it doesn't work. Even the big trials that they use to say it doesn't work, if you actually look at the data, they all show benefits, just not statistically significant. But when you summarize the trials, they all show benefit. But there's no evidence to show that it doesn't work. Yet they won't allow you to use it. So even if I were to give them, okay, let's say it's undetermined as of yet. There's some data showing it's working, some that's not statistically significant. Let's say it's not settled yet. Is it okay that I use it until it's settled because it's so safe? You would think on a risk-benefit analysis, you'd be supported in that. But that's the tell, though, Jan. That's the tell. The fact that they are absolutely suppressing and basically making it illegal to use a risk-benefit approach in treating, it tells you that they're frightened about ivermectin. Their goal is to make sure it's not used. And that's not about the patient. And the only way they can prevent patients from using it in this country is by going after the doctors. And so we've become targets.